The situation at the Okeu EU Hospital is worsening, and it is alleged 7 consultants have resigned this year, raising renewed concerns about the facility's state. During a Sunday, October 13th broadcast, Opposition Leader Allan Chastenet criticized the hospital's insensitivity and lack of urgency in addressing critical issues, accusing the St. Lucia Labour Party government of failing to show empathy towards patients and healthcare workers. On Tuesday, October 15th, former Castries Central MP Flood-Beaubrun called for Health Minister Moses Baptiste as well as other officials within the ministry to provide the nation with a much-needed update on how the situation, if true, is being addressed. The hospital is facing a staffing crisis, and many are calling on the government to address these long-standing issues before more lives are put at risk, which prompted the following questions to health officials by the former MP.
These doctors have resigned from the staff of VH. Do they still have visiting privileges? Because the question I want to know is, what about their patients who are there? Can they still go to the hospital, albeit that they're not members of staff? Do they have visiting privileges that they can still attend to their patients? I was told no. Again, I'm subject to correction. Mr. Minister, if I have misspoken, please quickly address the nation.
These resignations could leave critical gaps in patient care and cause many to fear seeking treatment at Okeu EU. Beaubrun outlined a list of all the alleged individuals who have resigned.
My understanding is that the head of the obstetrics and gynecology has resigned. Consultant. My understanding is that the head of surgery has resigned. Consultant. The consultant is the highest, most specialized doctor in the chain. My understanding is that another doctor, senior doctor in internal medicine, has resigned. My understanding is that the medical director has resigned. My understanding is that 2 junior house officers have resigned, 7 in the last 2 months.
In their leaked letter dated July 31st, President of the St. Lucia Medical and Dental Association, Dr. Merle Clark, criticized the healthcare system and the board of directors at the Millennium Heights Medical Complex, highlighting issues such as a lack of essential medical equipment, overcrowding, and a troubling exodus of their clinical staff. Beaubrun notes at the time of the letter's issuance and leak, 4 doctors had resigned and calls to question what had been done to address the concerns penned by the SLMDA.
Is the board at all concerned about the fact that 4 senior consultants and multiple junior physicians have resigned over the last few months? Or about the mass migration of nurses and the board, and it goes on. Today, and of course, I can only say what I heard because we haven't heard the Minister of Health come to address the nation on this very critical situation.
At Monday's pre-cabinet press briefing, Prime Minister Philip J. confirmed that he had learned of the resignations, saying, quote, "I am not happy about it, but people always leave to look for greener pastures. But again, that's nothing new," end quote. For Choice News Now, I am Chelsea Austinay.